Today, we are going to learn the fourth knowledge point of general theory of meridians and acupoints, the role of a meridian and the clinical application of a meridian theory. Lin Shu, Meridian chapter said, the meridian can determine life and death, to treat of all kinds of diseases, to adjust the false and truth cannot be impassable. This shows that the meridians and clitoris are really very important. So ancient doctors repeatedly stressed that if you don't know the meridians, as a doctor, you are wrong to do everything. The main effects of a meridian are the following four aspects. The first is to connect the Zhangfu organs, which can communicate inside and outside. Lin Shu Hailun chapter says that the 12 meridians belong to the vessels internally, externally connect of the limb joints. The internal part belongs to Zhangfu, and the external part connects the whole limb segment, forming a network. These contacts are mainly manifested in the relationship between body surface and body surface. What is the connection between hand and shoulder? It depends on the meridians. The connection between Zhangfu and Zhangfu. For example, what is the connection between the stomach and the large intestine by the long meridian and the large intestine meridian? The third is the connection between Zhangfu and body surface. What does the connection between the person's vessels and body surface depend on, for example, by 12 meridians? So Asian doctor says, 有诸内必行诸外, which means change inside must be reflected on the surface. By what connection? By the connection between the meridians. The fourth is a relationship between meridian and meridian. We talked about the 12 meridians circling in a circle to form the whole. How did they get in touch? The meridians are connected end to end. As we mentioned earlier, the law of the flow and the connection of the 12 meridians reflects a kind of a connection between the meridians and the meridians. Through the connection of meridians, the human body can form a whole. The second function is to move qi and blood and coordinate yin and yang. Lin Shu, Benzang chapter says that meridians move qi and blood, yin and yang, moisten muscles and bones, and drain joints. This shows that it runs qi and blood in the meridians, and qi and blood become yin and yang. It can nourish muscles and bones, joints, and the whole body. Therefore, we say that meridians are channels for the movement of the qi and blood in the human body. Qi and blood rely on the movement of meridians to move qi and blood to the whole body. The function of the meridian system is to move blood and qi and nourish yin and yang, which is to move qi and blood. Through the movement of qi and blood to coordinate the balance of yin and yang, maintain human health. Third, it can resist pathogenic disease and respond to symptoms. Lin Shu, the evil guest chapter, says that the lung and heart are ill, its qi stays in 2 elbows. Liver is ill, its airstream is in 2 axils. The spleen is diseased, and its air remains in 2 thighs. The kidney is ill, and its qi remains behind the knees. What does that mean? Through the connection of meridians and clitoris, some lesions of the internal organs can be reflected to the body surface. So we say that the meridians respond to the disease, visceral lesions through the meridians to the body surface. Now we are studying acupoints sensitization of this reaction point, which is an embodiment of the some meridian functions. It can accumulate pathogenic factors. When full of positive, deficiency, and evil, it can conduct pathogenic factors through meridians and clitoris. For example, from Shaoyang to Yangming, from this to another, Jin Gui Yao Lue has talked a lot about how the pathogenic factor transmit between the jiangfu organs depends on the connection between the meridians and collectories. So, the meridian lesions can pass to the visceral, which is shallow to deep. Visceral lesions can also involve the meridians, which are from the inside to the surface. In addition, between the jiangfu, through the meridian connections also affect each other. Usually, we see more liver disease can be transmitted to the spleen. Liver and spleen to regulate each other. So, smooth the liver to strengthen the spleen, and smooth the liver to harmonize stomach. Because there are so many connections between them. Fourth, it can conduct induction and adjust the deficiency and excess. 灵枢邪气脏腑并行 chapter says that 重气血则蒸游于相. 游于相 can also be explained that when we insert into an acupoint, the acupoint can get qi, and there can be acupuncture induction. There is acupuncture induction in acupoints, which can produce a conduction along the meridians. We often talked about qi to the place where the disease occurs, which is also called 游于相. Especially in 灵枢九针12元 chapter, there is a saying, 次之要，气滞而有效，效之性，若风之吹云，明乎若见苍天. That is to say, acupuncture is effective as long as you get qi, and the effect is very fast and obvious. It is also said in the chapter of 灵枢根结 chapter. That is, 用针之要在于知调阴与阳. It is said that acupuncture can adjust yin and yang and adjust deficiency and excess. In addition, meridians can also conduct acupuncture induction and adjust yin and yang deficiency and excess. Getting qi through acupuncture can adjust the induction of the body's physical and mental state. This is 4 functions of the meridians we talked about: lesions, communications, transportation, reactions, and so on. So, what is a clinical application of meridian theory? The first is diagnosis. It is said in the chapter of 灵枢卫气, that is, those who can distinguish the 12 meridians of yin and yang would know the cause of disease. Those who can understand the deficiency and excess would know the severity of the disease. That is to say, only we master the 12 meridians that we are able to diagnose the disease well. The theory of meridians and collectories is using in clinic, especially in our diagnosis, most of which is a differentiation of meridians and collectories, especially in the field of acupuncture and moxibustion. I put forward that the main line of clinic differentiation of acupuncture and moxibustion is meridian differentiation. We can apply syndrome differentiation in the meridian differentiation according to the symptoms belong to which meridian. For example, cough and asthma must belong to the long meridian of hand tie-in. First, identify the symptoms and return to the meridians, and then select points along the meridians for treatment. The second is to identify the position. Sometimes the pain is very obvious. We use the research methods of identifying the position of the meridian. For example, having Shaoyang headache and bilateral headache, we will choose Shaoyang meridian. This is a differentiation of position and meridian. Syndrome differentiation and location differentiation constitute the main content of the syndrome differentiation. The second is meridian inception, which was recorded very much in ancient times. In traditional Chinese medicine, corner can also be used to diagnose diseases. It is said that in the chapter of 灵枢论及整齿, it says, 鱼上白肉有清血脉者，胃中有寒. This fish in this sentence means major thinner. It is like the fish. We observe the color changed in its area. If there are blue blood vessels in the thinner, it means that the patient may have a cold in the stomach. There is cold in the stomach, blue in the major thinner, hot in the stomach, red in the major thinner. If major thinner is black, it means it's been cold and wet for a long time. It shows that his pathogenic factors are relatively deep and long. There are red, black, green, cold, and hot chi. Many diseases can be diagnosed only by looking at the change of the color of the major thinner. Third, it is also the special pressure diagnosis of meridians and acupoints in our acupuncture. The first is the response of meridians and clitoris. It can also be diagnosed by pain along meridians, soreness, tenderness, sensitivity, numbness, coldness, scorching, and some masses, some nodules, and some cords. This is through our eyes to see the change of shape and color. This change can be used to diagnose meridian diseases and vascular diseases. On the other hand, we can also see the response of acupoints by pressure or measuring. Its tenderness point, sensitivity point, numbness point, or the pressure or pressure on acupoints. Or there are some nodules, soft, sunken, which can also diagnose the corresponding lesions. Fourth, we combine with modern science and technology. That is, we use some electro measurements methods to carry out meridians and acupoints. Its principle is that the resistance of the body surface is balanced when the human body is in a health state. Especially, there is a high degree of balance at the corresponding point of the same level. Traditional Chinese medicine stresses the balance of yin and yang, and the balance of human body is healthy. Once the balance between yin and yang is lost, especially the change of a resistant and a current, disease will occur. For example, the resistance of feng qi and yamen points in patients with cervical spondylosis changed greatly, and the electric flow changed greatly. So some corresponding diseases can be diagnosed. Now we often use some meridian information diagnostic instrument to diagnose some diseases. Therefore, the diagnosis of meridians and acupoints, especially the measurement diagnosis and the objective diagnosis, is very promising. Second, in the treatment, meridian theory can guide our clinical treatment very well. The most important way to guide the clinical treatment of acupuncture and acupuncture is to select points according to the meridian. The most basic point selection principle in acupuncture and acupuncture is to select acupoints by following the meridian. Therefore, we should take a meridian syndrome differentiation as the main line. On the basis of a meridian syndrome differentiation, judge which meridian point and then conduct acupuncture. Because it can be ill in the meridians, for vascular diseases, we can choose cutaneous region. And for disease with stagnation of meridians and clitoris, pricking and bleeding can be done. These are some special acupoint selection methods. For the diseases of muscles and veins, we usually choose ulcer point. We prick the point where the patient reports pain and let blood out, and then applied acupuncture can improve the therapeutic effects very well. Therefore, the meridian theory is very important for the clinical application of acupuncture. So, meridian theory is also a good guide. The second is to guide the drug meridian, that is, clinical prescription. The meridian theory is also a good guide to use drugs in clinical prescription. There are a lot of guiding drugs. Which disease does need the guiding drugs to guide the meridian to the location of disease for better therapeutic effects? And this is application of meridian theory in our clinical practice of acupuncture.